Hello and welcome everyone. Today we are discussing about lymph node. In this video we are going to discuss about anatomy, histology and pathology related to lymph nodes. The lymphatic system is composed of lymphatic vessels and lymphoid organs. Lymphoid organs are thymus, tonsil, lymph node and spleen. This assists in acquired and innate immunity, in filtering and draining the interstitial fluid and recycling cells at the end of their life cycle. Lymph nodes are found at a convergence of major blood vessels, and in adults, approximately 800 lymph nodes can be found. They are mainly situated around neck, axilla, thorax, abdomen and groin region. The lymph nodes are kidney shaped. The function of lymph node is mainly to receive lymph via multiple afferent vessels and filtered this lymph and then pushes this lymph to efferent vessels. Nodes typically have an associated artery and vein which terminates into a high endothelial venules. Lymph nodes usually range in size from 1 to 2 centimeters and are enclosed in an adipose tissue capsule. They are considered pathological if they lose their oval shape, if there is a loss of hilar fat, and if there is asymmetrical thickening of cortex, and if they are persistently enlarged. These all conditions indicates the pathology of lymph node. Now let's learn in detail one by one. First layer is capsule. The outer surface is a capsule of lymph node. So this is a capsule. The capsule sends a trabeculae inside the lymph node which pass inward radiating towards the center. These all are fibrous trabeculae. These all are fibrous trabeculae. The convex surface of lymph node is pierced by numerous afferent vessels. These are the afferent vessels. The capsule is dense connective tissue stroma is made up of collagenous fibers. Next is subcapsular sinus. This is the sinus. The subcapsular sinus is the space between capsule and the cortex, which allows the transportation of lymphatic fluid. It is also called lymph path, lymph sinus or marginal sinus. So this is the sinus. Next is cortex. The cortex of lymph node is a layer beneath the subcapsular sinus. So beneath the subcapsular sinus, the cortex is formed of outer cortex and paracortex. The outer cortex mainly composed of B lymphocytes and paracortex is composed of T lymphocyte. Let's learn histology together. The cortex is made up of subcapsular sinus, cortical sinus and lymph nodules. Although both T cells and B cells are present in the cortex, the B cells are more abundant than T cells in this region. The nodules may or may not have a germinal center depending on if it is primary or secondary follicle. The primary follicle composed of small dormant lymphocyte throughout, while the secondary follicle has a heterogeneous collection of large B lymphocytes that have already been activated by antigen, which is called the germinal center. So this is the germinal center. Let's look closely the germinal center. The germinal center, this is the germinal center. The germinal center can be further subdivided into dark zone and light zone and mantle zone. The light zone contains centrocytes which interacts with follicular dendritic cells that expresses the intact antigen on the surface. In dark zone of germinal center, the majority of cells are centroblasts. They are highly mitotic and they are the source cell for light zone. The peripheral aspect of germinal center composed of quiescent B cells, which is known as mantle zone. These cells are characteristically intense basophilic, small cytoplasmic volume, and they have a heterochromatic nucleus. The fate of B cells in mantle zone can go one of two pathways. These cells either remain in the lymph node and mature into the antibody secreting plasma cells and remain in the lymph node, or they transform into memory B cells that re-enter the systemic circulation. The next zone is marginal zone. This zone is a light zone surrounding the follicles. It contains post-follicular memory B cells named marginal cells due to location at the interface of lymphoid white pulp and non-lymphoid red pulp in the spleen. However, marginal zone is rarely seen in the lymph node except in mesenteric lymph nodes. Now let's learn about the paracortex. Deep to cortical layer is a paracortex. Its margin blends with the superficial cortex and deep medulla. So, this is the medulla and this is the paracortex. The majority of cells here are T cells. They are CD4 positive, CD8 positive cells. Paracortex also has a high endothelial venules. Medulla. The medulla is the innermost layer of lymph node and it contains large blood vessels, sinuses and medullary cords. The cords are populated by plasma cells as well as B and T cells. And interlacing between these cords are distended areas lined by discontinuous endothelium, which is called sinuses. They act as a final point of filtration of circulating lymph. The medullary sinuses are the terminal continuation of periphery located cortical sinuses and they eventually culminate in the hilum of the lymph node to form the efferent lymphatic vessels. So this is the efferent vessels. From here the lymph flows through the valve through efferent vessels. Lymph vessels are lined by a single layer of endothelium. They are fitted with the valves that promotes the unidirectional flow of lymph from efferent to lymph node and from lymph node to efferent vessels. Let's see some common locations of lymph node in human body. First is cervical. It is divided into superficial and deep. Occipital nodes, mastoid node, preauricular nodes, superficial parotid nodes, submental nodes, submandibular nodes, facial nodes and superficial cervical nodes. These all are included into superficial cervical lymph node. Deep cervical lymph nodes are deep parotid and deep cervical. In terms of anatomical dissection, there are 6 levels in the neck, level 1 to 6. Other locations of lymph node are lymph node in upper limbs and lower limb and parietal and visceral lymph nodes of abdomen. Now let's learn about pathology. First is benign lesion. Infectious or parasitic disorders such as HIV, cat scratch disease, TB, leprosy. Second is inflammatory or reactive disorders such as acute non-specific lymphadenitis, Kawasaki's disease, Kikuchi disease, IgG4 related disease, Rosai-Dorfman disease, Kimura's disease, SLE, rheumatoid arthritis. This all affects lymph node. Vascular lesions such as angiomyolipoma, hematoma, hemangioma, lymphangioma, etc. Second is pathology involving tumors such as lymphoma. Lymphoma categorized into Hodgkin's and non-Hodgkin's lymphoma. CML, Erdheim-Chester's disease, follicular dendritic cell sarcoma, histiocytic sarcoma, Langerhans cells histiocytosis, metastasis and plasmacytoma. So this is in short about lymph nodes, and these are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.